Hello, my name is Congresswoman Pramila Jayapal, and I am so proud to represent Washington's 7th District in the House of Representatives and to be the lead sponsor on the Medicare for All Act of 2019. I introduced the Medicare for All Act of 2019 to expand and improve Medicare so everyone gets comprehensive benefits like medical, dental, vision, mental health, prescription drugs, long-term care, and more. And all of this with no copays, private insurance premiums and deductibles, and no out-of-network doctors. I am proud to work alongside an incredible and growing coalition of advocacy groups and grassroots partners such as People's Action, PNHP, Students for a National Health Program, and NNU, who have been fighting for healthcare as a human right for years. And I'm so sorry that I can't be with you in person today, but I deeply appreciate the work that you're doing to help build the people's movement for Medicare for All. I stand with SNAP, which represents the next generation of medical providers leading the charge to push the American Medical Association to drop its decades-long opposition to single-payer healthcare. This would be a critical step forward. In the past, the AMA opposed important social programs that proved to be critical and popular for Americans and our well-being. Programs like Social Security, Medicare, and Medicaid. We hope that the AMA has learned from those moments and now will join us in supporting Medicare for All, as so many physicians across the country have already done. The truth is, the AMA needs to decide who they really represent. Is it the growing majority of physicians across the country who know that their patients need health care and physicians who were trained to practice medicine and now instead find themselves fighting with for-profit insurance companies? Or is it the only beneficiaries of our current profit-centered healthcare system that puts those profits over the health of patients? The AMA needs to cut its ties to groups that are funded by for-profit insurance, for-profit hospitals, and big pharma, and get back in the business of ensuring that healthcare is available to everyone across our country. Today, 56% of physicians support Medicare for All, an even greater majority of medical students and 70% of patients want Medicare for All. This generation of physicians and the next want Medicare for All to allow for a future where providers have a better chance of doing what they went to medical school to do, deliver care and save lives, rather than spending hours on paperwork and billing that keeps them away from their patients. This generation and the next of doctors do not want for-profit private insurance companies dictating their clinical decisions. And most importantly, this generation and the next of doctors want their patients to access life-saving treatment instead of being denied it due to cost. I hope the AMA listens to these voices and this time makes a choice that puts the AMA on the just side of history, a history that gives the American people what they deserve, guaranteed, affordable, high-quality health care for everyone. I ask the AMA to join me in upholding their mission of bettering the public's health by committing to a system that is equitable and puts patients over profits, a Medicare for All system. We can make Medicare for All a reality, but we have to do it together. I'm asking today for the AMA to drop their anti-single-payer language and their membership in the industry-led coalition, the Partnership for America's Healthcare Future. Join us in the fight for Medicare for All. Let's all be on the just side of history together.